people do not know about the growing epidemic of renal failure, and with the steady increases of hypertension and diabetes, renal failure is also bound to increase. Consequently, a diagnosis of end-stage renal failure is only the beginning. Then to continue a seemingly normal lifestyle, dialysis becomes the only choice in which the most common form is hemodialysis. However, with hemodialysis, the patient and the nurse have to deal with the complicated procedure and abide by certain rules and regulations in order to safely perform this procedure, which deals with anything from the process of dialysis to taking care of their access sites. After recently visiting a dialysis center for clinical, I now know the various steps that the patients and nurses have to take in order to have a safe and successful dialysis. Although the general concept of hemodialysis seems simple, it actually entails more information that most people do not know about. Hemodialysis contains two main goals. One is for uremic toxin removal and restoration of fluid. The other is to maintain electrolyte and acid-base balance. A fluid called dialysate flows through the dialyzer. The dialysis machine controls the flow of blood and the dialysate. The dialysis machine has two systems, the extracorporeal system, which is outside the body, and the dialysate delivery system. The extracorporeal system is the tubing, blood pump, heparin pump, and the dialyzer. This circuit also monitors for blood flow, blood pressure, and air bubbles. The dialysate delivery system of the machine mixes the bath with purified water and checks to be sure it is safe. Then the water is used to make the acid and bicarbonate. With hemodialysis, the blood filters through an artificial kidney, and in this artificial kidney is a dialysizing membrane, which serves as a filter to clean the impurities from the blood and pull off excess fluid. During hemodialysis, different equipment is utilized. The equipment is first primed with normal saline to eliminate chemicals from the equipment, and then refilled with fresh normal saline to prime the tubing for dialysis. From the graft, fistula, or catheter, which is placed inside the patient's blood vessels, two lines are inserted. From the blue line, the blood is pulled from the body. Then the dialysis machine aids with the circulating of the blood by a spinning mechanism called the blood pump. And then the blood goes through the artificial kidney, where waste products and toxins are filtered from the blood through the dialyzing membrane. In the dialyzing membrane, bicarbonate and acid flow into the blood and regulate pH and push out the excess fluid by osmosis. Then the clean blood is returned to the patient via the red line. During dialysis, heparin and normal saline are used to keep the blood from clotting and from losing volume. Before a patient undergoes dialysis, they need to have one of three lines in place. For example, fistulas directly connect an artery and a vein. They are the best way to get access to a bloodstream for hemodialysis and can last up to 20 years. Another access device, a graft, is a tube made of plastic, usually connecting an artery to a vein, which is the second best way for dialysis. The third type of access site remaining is the Tessio catheter, which consists of a tube inserted into a vein in the neck or chest. Used only as a temporary access, doctors and patients utilize catheters as a last resort, but for some patients it is their last option. Then the catheter becomes a permanent access device. Before hemodialysis, each access device must be properly assessed. For fistulas and grafts, the nurse looks for any signs of infection such as redness, swelling, tenderness, and the nurse must be able to auscultate a bruit, which is a swooshing sound, and feel a thrill in the graft or fistula. This sound indicates that the arteriovenous connection is patent and that the blood flow is normal. This site needs cleaning before accessing and after dialysis. The patient holds pressure for 10 minutes to the site until bleeding stops. For a catheter, however, a nurse still monitors for infection and with sterile technique cleans the site and applies a new dressing. Before and after use, the nurse assesses for patency and flushes with normal saline and heparin. Patients should be advised not to swim, shower, or submerge the catheter site underwater. Blood pressures must not be taken from the access arm, and the patient should be encouraged not to wear constrictive clothing or carry a purse or bag with that arm. Then the line is reclamped for the next dialysis. Lastly, dialysis greatly affects the patient's life. Patients have to come into treatment for 3 or more times a week for at least 4 hours. Clients have to restrict their fluid intake and carefully monitor their diet, and families have to plan around the patient's treatment. Clients may have anxiety and depression because of dealing with demands of treatments that interfere with their daily lives. The adjustments made for dialysis will be challenging, and the nursing staff should openly be ready to help clients and should teach people about the realities of dialysis and how to prevent renal failure so that hopefully this disease can be stopped.
Very good.